So thank you very much, Dr. Dzau. I know conflict of interest is top of mind for many of us who are contemplating the prospects of shared value or just seeking to better align our social investments with our business objectives. So we really appreciate your perspectives on this important topic. So I think we have some time for a couple of questions. So as a reminder, use your tent cards for the forum members and other participants. There's a mic at the center of the room. Clarion.
Good morning, Dr. Dzau.
Yeah.
My question is this, and it's a more practical question since the old adage, no good deed goes unpunished, can sometimes occur when you put something together like this. Who's responsible for the initial response? Tomorrow, the Raleigh Ledger says that your organization, the Duke, is receiving money, et cetera, and cash dispersions. Who responds immediately so that it doesn't explode and that you protect the NGOs and anybody else who wants to work with you?
Yeah.
Is it the legal department? Is it McKinsey? Who puts that into place?
As you know, in all organizations, we in fact have depending on the level, a crisis management team. We have that team consists of communicators, lawyers, and in this case, faculty and others. So we've learned from a number of experiences that actually the best way to handle this is to have such a team ready to go anytime. And the chief executive will call that team to enable that response. Obviously you don't always want to activate this team. So in a lower level, it's usually that we have a spokesperson who actually consults with the various experts within the organization, whether it's a lawyer, et cetera, and create that kind of reaction and response.
Thank you.
Thank you.
Ben?
Thank you. I enjoyed your talk. I'm not sure there's an answer to this question, but it's the challenge, the practical challenge that I have around conflict of interest. It's particularly true in emerging markets, developing countries, where in sub-Saharan Africa being, I think, a good case example, and I think probably other colleagues in similar positions in large companies like ours have this issue. Typically, a project will come up that looks like a really great project. Let's say it's in Mozambique. And the government is actually actively involved in the project, and they're seeking private funds because that's the good thing and the way it will move forward. And I get challenged by the compliance people at our company because of the concern that the government also makes a lot of purchasing decisions and influences purchasing. And as a result, if we go into some type of partnership that supports something that the government is focused on, it's perceived as a conflict of interest, and I'll tell you, it's very hard to get over.
Yeah. That happens all the time. I can sort of give you a few thoughts. First, my first answer to you is not as relevant to your issue, but is what Brenda does. That many companies have created foundations where they can actually support what appears to be really independently making decisions about to support what are good social good issues. But I would say that even with that independence, there's always some relevance to, in fact, the mission of the company, Medtronic, and what it does in terms of a foundation that makes decisions what to support. Certainly you can take it to that foundation for their support. Second is also to create specific units which are more involved with social good, even though it may be well incorporated into the operations rather than foundations of the company. And so again, from my own experience, and Justin is here, he can tell you how Medtronic puts it together. And even though there's overlap in interaction, that decisions can be made quite independently and being compliant with this. So I guess creating an arm's length is important. So it's not seen as, while you're selling something, you're also making a very specific relationship with the people that you try to sell to. Thank you. How do you deal with it, Ben?
I try to make the best case possible that it really is unrelated to the business operations and decision-making, and really and just really push it. You need to be a champion and really advocate and say, look, this is the right thing to do. It has nothing to do with business operations, and push it and push it and push it and push it through it takes a champion.
Yeah.
I'm not usually successful, I can tell you right now, but
I mean,
whatever.
isn't that exactly the case? That's why I do believe that by if companies are having a unit that's more focused on, and usually, they could be under global business, it could be under some other, depends how you frame it, right? And maybe Justin can say a word about how Medtronic puts it together, but it allows some independence that actually goes up a separate pathway, because what your lawyers are trying to do is they're trying to protect the company from actually crossing some lines that will be criticized for. So that unit can actually, in many ways, come to you for funding and look for maybe different sources of funding, but making that decision that seems to be independent from you having also a product responsibility. Sandy.
Yeah, hi, Sandy Schwartz, University of Pennsylvania. Victor, I agree with your first slide where you talked about the importance, if we're going to make a change, of aligning the incentives and the interests and involving private sector activities in pursuit of public good. But as you talked about it, I just thought that the guidelines and the procedures that we've developed for academic institutions, or for the IOM, NAM, NAS, I don't think are quite address all, as you noted, all the issues. And I think maybe this forum would be a useful activity, Clarion, to form a group that would look at what adaptations, if any, might be required to address the unique issues that are raised by these types of public-private partnerships. Because, what we did in universities were developed for our own narrow purposes, in what, company relationships with academic centers, same reason. And I really think you've raised a lot of unique challenges that this group seems to be the ideal group to develop.
Thank you. I totally recognize it in the last part of my talk, which is more university-oriented. The first part, in fact, is what's out there in the PATH and Gavi and others, and how there's a tremendous overlap. But I think there's also specificities, particularly since that the product relationship, public-private partnership, particularly, say, if you have a malarial drug which you want to deliver to a region, and that is an NGO that have that relationship because you can have access to a drug at a much lower price, it does create this perception of what happens, are you actually favoring them or not. By the way, one thing I didn't mention is the issue of exclusivity. I think to the extent possible that none of these relations should be exclusive. That opens up the true area of competition and fairness. So that should be on that list as well.
Yeah, I was just thinking, though, that, I'm a general internist. So when we get clinical practice guidelines, they come, you get one from the cardiologist, and the general rule of thumb is if there are more than 2 sets of guidelines, you ignore them, because it means there's no consensus. And I think what PATH and other groups have learned is very useful, but I think there may be a unique role here at this point in time for a group like the IOM to develop a standard, or just like it's done with clinical practice guidelines or comparative effectiveness research or safety and monitoring, to set sort of a standard that people then can locally adapt to their own needs. But at least I think there's enough that's been learned there that it might be an appropriate time to, and you can't go wrong underestimating my knowledge in this area, so, I recognize that, but in terms of it might be the right time to try to bring this together and see, are there some common principles that are needed to supplement or adapt to what has already been used for the other purposes.
Sandy, I think you're so right. Thank you for actually making the suggestion. What Sandy is saying is you have an opportunity perhaps to take it and to set some, general guidelines or agreement that can be used more broadly based on looking at what's out there versus what you think is needed. Now, IOM, as I said, had a report in 2009 on conflict of interest. It's really not a consensus report, if I remember correctly. It's the output from a workshop, I believe, from, I think that's what it was. I think it came from Andy Pope's board. But, if you want to have formal recommendations, there's enough interest out there, in my opinion, and enough of you wanting to get it resolved, they can do a true consensus report. And actually, that could be a very good thing to do for the field. So if you can say, this is what the IRM guideline is, and we're going to live by all those things. That's a great suggestion.
Well, thank you very much.
Thank you.